Firstly, thanks so much for coming along to this evening's event. My name is Craig Morgan. I'm co-director with Hannah Kienzler of the ESRC Centre for Society and Mental Health, which is sponsoring this event this evening. Our ESRC Centre is a research centre that is dedicated to trying to understand the connections between social change, inequalities, and mental health. And so the question that's posed for the panel this evening is the question that's right at the heart of the work that the Centre is interested in. I'm not going to say much more than that, in fact, nothing any more than that, but I'm going to hand you over to Claudia, who's going to chair this evening's session. Thank you, Claudia.
Hello, everybody. I'm really delighted to be here to chair this event on such a crucial topic. My name is Claudia Hammond, and I present All in the Mind on BBC Radio 4, which is a programme about psychology and neuroscience and mental health. I've been presenting that for 18 years now, and I was reporting for it before that as well. And so again and again, issues come up where it's clear that one of the factors that is affecting people's mental health is inequality in various different forms. And I share the frustration of the title in a way, of the why are we so bad at doing something about it, that still comes up again and again and again as being an issue, and you wonder, well, what are we going to do about it, and how's that going to happen? So that's what we're going to talk about this evening. We have a really lovely panel here who have battled through the rain. Those of you who have been indoors all the time, you're very lucky, because it's been lovely for you being in here. Various of us got rather soaked in different ways. So they've battled it through the rain, as some of you might have done to come here. And some of you might have been at the conference that's been taking place here all day, hearing about the work that the Centre's been doing over the past 5 years. And one of the things you'll have heard is that there is ample evidence about why inequality does matter when it comes to mental health, and that more equal societies lead to better health outcomes. So we want to ask this evening how interdisciplinary research on society and mental health can play a role in encouraging longer-term change. So what does research in this field need to look like, and how can it help to shape public services or policies or work in the community to improve the chances of good mental health to everyone? So I'm going to spend some time asking our lovely panel for their thoughts, but please do be thinking of your questions for them later on as well, because we have such an interesting and knowledgeable panel with so many different experiences. And so first of all, what I would like to do is to ask each of our panelists to introduce themselves and how your work is related to mental health. So Kwajo, can I start with you?
Yes. Can you hear me? Yes. Hi, everyone. My name's Kwajo Tweneboa. I want to first and foremost say thank you for inviting me down today to be on this panel. I'm a housing campaigner, so essentially what I've been doing for the last year, well, few years, not last year, is travelling the country and basically exposing the conditions people have been forced to live in, often in, it's slum conditions they've been forced to live in the social housing sector and in private rented accommodation too. But talking about housing issues as a whole is what I've started doing, especially of recent. And I mean, I've had thousands of people reach out to me over the years, and it's all because of, one, the conditions that they're living in, but two, because of the impact it's having on their mental health. So every time I go into a house, I always have a conversation with a family, with a parent often, or individuals, young people, children, who are subject to living in those conditions, or who don't have access to a safe, decent, affordable place to call home, who are homeless. And we often have conversations around how it is impacting their mental health, and they're often pushed to the absolute very edge. So that is the link between mental health and the work that I do, and it's an issue that affects millions of people up and down the country.
Thank you, Kwajo. And Cassandra Lovelock, can you tell us what you do?
Absolutely. So it's lovely to be here. I'm Cassandra Lovelock. I am a research associate at the Centre, which is hosting our event today. My research primarily looks into the intersection between people claiming benefits and their mental health and sort of the emotional distress that they're experiencing. And then I also look at sort of unpaid carers and unpaid carers' sort of knowledge and information seeking around health and social care, particularly in a mental health space. So that's what brings me here.
Thank you. And Will Snell.
Thanks. So my name is Will. I'm the Chief Executive of the Fairness Foundation, which is a small charity that aims to persuade politicians in the UK that tackling inequalities of all forms should be a priority. And three arguments: the moral argument that inequality is inherently unfair, as you'd guess from our name. Secondly, the political argument that people are really concerned about inequality and want action to tackle it. And thirdly, the policy argument that inequality is damaging our society, our economy, our democracy, people's mental and physical health.
Thank you. And Omari Hunte.
Well, yes, my name is Omari Hunte. I work for BIGKID Foundation. My particular role with them is to basically I use my skills in terms of copywriting and the social media and doing the comms to kind of give the youth a voice and kind of share their stories as well, because when we look at particularly youth, and especially when it's on LinkedIn, Instagram, wherever you're reading, it's usually statistics regarding our youth, and I try to give them more voice to kind of celebrate so that they feel celebrated and they know that they're worth more than just statistics. Because for them, even for me just growing up, you know, when I go on Instagram or wherever it is and I look at other young people, all I'm seeing is statistics. So I wanted to change that, and BIGKID has helped me and pushed me to be able to be in a position so I could change other young people's lives and kind of give the impact and share the impact that they're also doing, so that they don't also feel like just another number. They feel more that they could impact within our community. So that brings me here today.
Thank you. And Andy Bell.
Hi, thank you for the chance to be here today. I'm Andy. I work at Centre for Mental Health. We're an independent charity. Hopefully you've come across our work. If you haven't, please follow us. And we're dedicated to tackling inequalities in mental health throughout our work. It's predominantly research, but also policy analysis, a little bit of training, quite a lot of making trouble, and trying to bring about change across the country to both tackle the social determinants, the unequal social determinants of our mental health, but also the unequal life chances people experience when they have mental illness.
And finally, Karen.
Hi there. Thank you so much for inviting me to be on the panel. I'm Karen Glaser. I'm a professor of gerontology here at King's. A lot of my work is looking at inequalities in health and well-being in later life, both from a life course and cross-national perspective. But I'm here on this panel because together with Professor Ben Geiger, I co-lead the Work and Welfare Program. So we've been doing a lot of research looking at the impact of changes in working conditions and also welfare reforms and broader social policies on health, on mental health and inequalities.
Thank you. So you can see we have a huge breadth of experience here. So I'd like to start by asking each of you to tackle this question from the perspective of your experience of why we're so bad at doing something about inequalities, even though we know they do matter. So I'm going to start again at this end. This is the last time I'm going to go in order, but I am going to start again with Kwajo.
It's a very good question. I often think in terms of inequality and those that suffer most, perhaps there isn't enough political will there to want to tackle it. And often with these issues, I mean, change comes from government, whether we like it or not. They're the ones in charge of really implementing that change. We've seen it around mental health, we've seen it around the public sector, and how funding has been slashed over the years. But inequality and these issues, it's not something that we woke up yesterday and these issues just suddenly existed. These issues often, whether it's housing or mental health, you look at the NHS, there's so many issues out there where these issues have been growing for generations and allowed to grow, and it often takes getting to a point of crisis before we realise, well, actually there is a problem, and by that point we have a group within society who are really, really struggling, really, really suffering. They're the same people that I go out and see on a daily basis, and I talk specifically in relation to social housing. They happen to be a specific class of people, often working class individuals, who are struggling most, who do complain, but are ignored. Their mental health and their mental health struggles are ignored. Their housing situations are ignored. And they're suffering in silence fundamentally, and it's wrong, because I, like, as an individual anyway, want to see everyone as equal and deserving the same support. But unfortunately, because of inequality, that doesn't happen, and there hasn't been that political will to really focus on it and say, do you know what, there is an issue here. It's affecting a group of people. Social housing crisis, I mean, when we talk about the housing crisis in general, it's very acute when it comes to social housing, especially in the private rented sector too. Yet enough hasn't been done to try and tackle it up until this point. And I'll make the point around, I wanted to make this point around mental health, and specifically Mental Health Awareness Week. It's something that I dislike. I was going to say hate, but that's a strong term. And the reason I say that is because for Mental Health Awareness Week, and I've noticed this especially after lockdown and doing the work that I did and started out in lockdown, we focus on this issue of mental health for 1 week of the year, and then right at the end of Mental Health Awareness Week, it's time to switch that off and everyone's mental health is fine all of a sudden, when that isn't the case. And what we actually need is systemic change, and I'm not talking about that 1 week during the year, I mean all year round, because mental health is something that affects many people. It can affect absolutely anyone, and it perhaps hasn't had the focus and investment that it should have. Just as, I mean, we talk about like physical health, for example, and I mean, the NHS right now is a bad example of talking about investment and having to invest in like healthcare and whatnot, but we have to treat it as equally as important, especially after lockdown. And we've seen in the media of recent situations where people have come out and they've spoken about the way in which their mental health has been destroyed. I remember one lady that I spoke to actually said to me when I went into her home, she said, I don't even want to, she said, my mental health is damaged, but I don't want to even talk about it because I'm worried my kids will be taken away from me. And it's those sort of conversations that aren't being had, that are being ignored. And people are just left to suffer and deal with it without that help. And that's the real life instances and real life cases that is happening up and down the country. It's not just this one individual family. It's happening across the country. And it comes back down to inequality.
So for you, it's a lack of political will that's happening. Cassie, what would you say? Why are we so bad at doing something about it?
Ooh, I personally think one of the reasons we're awful at doing something about it is because no one wants the responsibility of doing something about it. So when we, particularly work that myself and Annie up here do, we are doing secondary data, looking with lots and lots of people around the reasons they consider themselves mentally ill. And all of those reasons, or the vast majority, are this sort of social determinant side of these things that you've mentioned already: worries about having your kids taken away, experiences of domestic abuse, just leaving prison, or experiences with the criminal justice system. All of these things are what people are saying, which are inequalities, are the thing impacting their mental health. And then they go to their GP and they get sent to mental health services. Like, that is equipped to deal with any of these questions. So I think for me, when we're talking about, yes, inequalities matter, yes, we know they impact mental health, the question lies in the question of going, who is meant to be answering that? Because right now we're putting work coaches in mental health services, we're equipping more people in mental health services, we're dealing out more medication than ever. And are any of those things tackling inequality? Not particularly. So for me, it lies very much in that question more than anything else.
So does it get put down to being something to do with the individual in the end, when they're not looking at the bigger, what's going on in the rest of their lives?
It's exactly that. And then when we see the moves that the government are making, how they're making it the way they talk about mental health, all of our government for the last 15 years and our current government are all talking about it in the same way of going, how do we make this community of people economically active, as if that's an outcome for your mental health? If you're working, you clearly are mentally fine, and I think we all know that's not true. I'm on this panel from a lived experience perspective, happy to tell you how mentally ill I am if any of you are interested. But also, I'm right here and I'm working. So it's that balance where we've equipped work to be this endpoint and go, you're mentally better, there you go, but we're not tackling any of the reasons people get mentally ill in the first place.
Will, what would you say? How would you tackle this question?
So I'd agree with both of the previous comments, and just, I guess, build on them, thinking about why we're bad at tackling inequality in general, not specifically related to mental health. It feels to me that there's two big issues. One is how we think as a society, and the way in which we think in a very kind of meritocratic way. We want to believe we live in a fair society, and we think in a very individualistic way, which goes back to the point about seeing things in terms of individual outcomes, but also this sort of tendency to think about individual responsibility and to think less about systemic drivers. And then the second set of barriers to me, which links to the point about political will, is the structural barriers to change in terms of politics. So, you know, again, thinking about inequalities in general, for example, around wealth and income, the power the vested interests have to block progress, whether that's through using their influence to lobby and influence political decisions, or various other mechanisms. Politicians acting in fear of what the public reaction will be, partly because of the media role and the way that media ownership structures have an impact on how the media reports on reforms to tackle inequality. So there's those sorts of issues as well. The way in which power and decision making is so centralized in this country, both in terms of the lack of devolution of power to regions and the grip that the Treasury has on decision making in central government. The fact that our policy making is so short term focused, and that the economic system as well doesn't look at long term issues and consequences. It's a sort of boiling frog idea that we're insufficiently focused on future crises because of everything that's seen as a short-term priority. So lots of really knotty structural problems. On a positive note, I would say that we've done lots of polling about what people think about inequality in the UK. When we ask people about the impacts of inequality, they are very quick to recognise the impacts of inequality on mental health, much more so than they are to recognise the impacts of inequality on our economy and society, for example.
That's interesting. So it's not as if it's a message that needs to be got over somehow. You think the message is already over? People know about this?
I think, and it probably has changed, in the last few years, but the counter to that is the underlying kind of values and mindsets are not compatible with that, so there's a tension.
I was interested that earlier you said that there were three arguments that you look at, the moral, the political and the policy arguments. Which of those do you find holds most sway with people who do have power?
It depends who with. So I think this new government are more open to all three than the previous government. I think there is an interesting opportunity to persuade more people on the right of politics that inequality is bad, even if they don't agree that it's unfair.
Omari, what would you say to the answer to this question of why we're so bad at doing something about it?
Particularly for me, and I can speak for a lot of young people that I kind of deal with as well, I feel the system feel like it's a straight line in terms of how to deal with mental health, and I don't think that that's the right way to even think about it in the first place, because anyone that's experienced any sort of mental health, depression, whatever it is, knows that it's not a straight line. And the minute a young person comes to, let's say, a teacher or whatever about what they're dealing with, the instant thought is therapy. And I can speak for me, and I'm not sure if I can speak for anyone in here, but therapy doesn't work for everyone. And the minute you don't fit that system, or the minute you don't fit that straight line that they're offering, you're kind of forgotten about. And the minute you're forgotten about, a young person now feels like they're broken. And what do you mean you're broken at 15? Like, what does that even mean? And it's sad to hear as well. And the minute they're forgotten about, there's no way for them to even feel empowered to even talk to anyone. Like you were saying, about the women that you spoke to, a young person now feels that because they're forgotten about, they don't even want to speak about their mental health. You go to ask them what's wrong, I'm fine. And they're not fine, but there's nothing that you can do, because all their life they've just been told that, they've been given a label that they're not okay, which I feel like is wrong as well. And for me, when I went through therapy, I didn't feel like it helped, because it was just there was like online Zooms and everything. There was also, so like now, especially after lockdown, the in-person kind of factor has gone away, and it's a lot more online, and I don't feel like online really helps. I mean, sometimes it does, sometimes it doesn't, but there needs to be more change and more variety in ways to help young people in terms of mental health and the inequalities that they're facing, because like I say, it's not a straight line, and the system kind of just gives you that straight line, and once you don't fit that, you're kind of just forgotten about.
So in an ideal world, what would you like to happen if a young person goes to, say, their teacher and says that they're struggling, and perhaps they're struggling with their mental health? What would you like them to be able to do instead?
So I was saying this to my mum actually a couple of days ago, that I feel like it's less what the solution that you can do for a person, is more that what you allow them to do. And I mean that when I say that when a young person now comes to a teacher and they say whatever they're dealing with, it's less so, okay, I'm going to give you to the health and well-being leads. Sometimes all that young person needs is just for you to listen to them, and just for them to feel heard, for them to feel seen, and not for them to just be brushed off and passed on to someone else, because then they're feeling like, okay, something's wrong with me, why can't I talk to, I don't know, Mr. Dave, whoever his name is, or Sir or Miss, then it's like, okay, something's wrong with me. So I just feel like it's more letting them feel heard, feel seen, letting them talk, and just feel like they're listened to.
That's interesting. Rather than offering solutions or passing them on to somebody else to try to do something, that would be, in some cases, enough or something powerful?
Well, it's never enough because there's also more that just a conversation. Because obviously, after a conversation, you now know, okay, next steps and whatnot. But it's the fact that the minute a young person, and I speak from experience, that once you go to someone with whoever you're dealing with, it's the first thing is brush you onto someone else. And for me, I feel more at ease and feel like I'm more capable when I'm able to speak and just feel listened to. I may not even need to go to therapy. All I need is just for you to listen to me, for me to get whatever off of my chest, and that's it.
That's interesting, thank you. Andy, how did you respond to this question of why we're so bad at doing something about inequality when it comes to mental health as well?
I mean, partly I'd say listen to those guys. I think it's really important we remember that mental health inequalities are economic and social inequalities. They're not different. They're the ones that divide our society, and I think two words that have come out are really important, are wealth and power. Because a lot of the inequalities, and let's call it what it is, injustices and inequities we're talking about, when you really boil them down, they come to inequities in wealth and power. The reason why women have higher rates of poor mental health than men is almost certainly due to discrimination, male violence, and higher rates of poverty. The reason black people have higher rates of mental ill health and poorer experiences of mental health services is due to racism and discrimination, and that works the way it's across both mental health services and the wider society. I could go on across every dimension of inequality, and of course they all overlap with each other anyway. So I think we have to understand that it is intensely structural. As has already been said, there's quite a lot of vested interest in keeping it that way. And so when we're wanting to change it, we're wanting to change some quite fundamental stuff. You know, the best therapy is probably a fairer society. The problem then is it can feel to individuals, whether you're a citizen or a mental health worker or a GP or a teacher, there's nothing you can do about it. It's all to do with the government and capitalism and big things that we're somehow not culpable for. And so it's how we then think, well, how do we create agency? And we know that mental health is made in communities, so one of the things that really interest us at the centre is where we've seen examples of where communities have thought, well, we're not going to take this anymore, and actually try to kind of build a more equal society from the ground up. And I think that's where really interesting things are going on. That's where we can begin to challenge some of those power structures. It's not going to happen overnight, but I think we do need hope, and we do need that sense that there is stuff we can do while we're waiting for government and those bigger things to perhaps come around to a different type of conversation.
So that's interesting. Have you seen examples where that can work really well, even though that's not making big structural change, which, as you say, is a huge thing to try and do?
I mean, you can make big structural change bit by bit, can't you? I think one of the most exciting things that happens in mental health services is where they offer up people really good advice and support to deal with their income and housing situations. We talked about the importance of housing to mental health. If someone's in appalling housing and threatened with homelessness and at risk of multiple health problems, or indeed if the person goes to hospital and they lose their home, which happens, unbelievably, you sort someone's housing out, you're much more likely to help them to have better mental health in the long term. So if we can see ways in which you can actually create change bit by bit, it's structural if you do it a lot. And that's really important. We see those structural things, but we see that there is action that can happen around those.
Thank you for that. And Karen, what would you say? Why are we so bad at doing something about it?
I agree this is a really tough question, and one I've thought quite a lot about. In the context of the work and welfare program, we see that kind of social policies and working conditions really do matter. And I guess this gets to the broader ethos of the centre, which it's not just about healthcare policies and the delivery and design of healthcare services, which are of course very important, but I think everyone has mentioned these kind of wider structural factors. And so I think there are two reasons. One is that social policies are often designed in their respective silos. So when we're designing employment policy, you don't often consider health. We do a lot of work, for example, in pension policy and social care. You don't often consider the health implications of that. And secondly, there should be health in all policies. And I don't think policymakers really think like that. And so really it's important to consider the kind of the potential health and mental health implications of any kind of policies you
And is that to do with knowledge? Is that because policymakers aren't going to know enough about health to be able to do that and take it into consideration, or do you think it's not thought of?
I think it's not thought of. So, you know, for example, when people design pensions policy to make people to work longer, they're thinking about getting more people in employment, but they're not thinking of the potential health consequences of that, or mental health consequences.
And that's a really interesting example, actually, because I know you've been working on pensions.
Yeah.
What would be do you think there's an impact on mental health, say, of that policy of people working for longer?
Yes, and actually this was mentioned this morning in work that we've done, and with Ludovico Carino, who's here. We looked and we saw that working conditions really mattered for that, and especially for women. So the kind of consequences of having people work longer and having women work longer, because there was quite a big jump from 60 to 66. If your working conditions were such that you were in physically demanding or psychologically demanding jobs or less flexible jobs, you actually had detrimental consequences for mental health. So while it might get people into work, they might have unintended consequences, and that's, I think, that the policymakers need to think a bit more about unintended consequences of certain policies.
And so this brings us on nicely to what role research could play in trying to achieve equality. And so, Karen, as somebody who is leading a research program, how important is research to all this? Is research going to then change policymakers' mind that then changes policy, or is research going to change everybody else's mind?
As a researcher, I think research is really important. Of course, I would say that. I think research can make big differences in many ways. I mean, I would say within this area, so within the area of kind of work and mental health and consequences and social policy, I think there's a lot of kind of debate and uncertainty around the relationship between economic inactivity, health and welfare reform. So, you know, you see all these reports about huge rises in economic inactivity. Is that going on? Is that being driven by poor health and poor mental health in particular? And is this true at all ages? Is it true for young people, and is it true for older ages? I think we need a lot more work. We've done work on looking at, you know, changes in work and what that means for mental health, but we need much more on the kinds of working conditions that can keep people in work if they wish to do so. And we've done much bigger evidence based on the consequences of social policies.
And is it just a question of more of it, or do different kinds of research need to be done and need to be funded?
I think different kinds of research need to be done. We talked a lot about co-production today and involving more people with lived experience, in partnership, and not only shaping the research, but working, collecting the data, owning the data, and I think, different types of evidence. So not just the kind of the traditional randomized controlled trials, or I'm a quantitative researcher, so research with numbers, but we need different kinds of research evidence. And the wider the research, the broader the research evidence base, the better.
And Cassie, you're somebody who's working in research and using your lived experience to add to that. Would you like to see different sorts of research? What would you like to see change?
Ooh, I think for me the biggest thing which needs to change in research is actually the people that are doing it. No offense to my many colleagues, which are right here. I think I approach all of my research from a lived experience perspective, regardless of what I'm looking at, whether it's mental health or unpaid care or as a care leaver, that always comes into what I do. And I think what we need to be doing in research is equipping more people from all of those scenarios to be leading the way. When we think about inequality, we've already talked a lot about gender, we've talked about race. We need to be equipping people who have had unequal access to things through things like social determinants, whether it's the things I've mentioned around being an unpaid carer or being a care leaver, but also determinants around things like developing a physical disability versus being born with a disability. I think in research we are particularly guilty of treating groups as monoliths. We have pensioners and then we have young people. Like everyone in those groups is exactly the same, and they're really not. And what we need to be doing is looking at the diversity within those groups and then giving those groups money to generate what they think is really important, because that's how we're going to answer the questions which will create change. It's all well and good us as academics looking around, looking at our literature gaps and going, oh, that would be really interesting, and oh, for us as an individual we can publish a paper there and we can do a talk like this to a room of interested people, but is that going to be answering the questions which will make change? I personally don't think so, and I do that for a job. So.
That's interesting. And so what is it specifically about the lived experience of researchers that would make a difference to what research gets done? Is it what research would get done in the first place, or the questions that would get asked within it, or what?
What research would get done in the first place is a little bit dependent on funding, but particularly the questions which will be asked within that is the thing which primarily will change, as well as Karen's already mentioned, the methods that we do things. I think academically we have a really standardized way of thinking about research. We think about our randomized control trials, we think about our big data sets, and then we think about our qualitative methods as the, in my opinion, like nice fluffy after, and I'm a qualitative researcher. So, but I think even in the methods we deliver research, when we're equipping people from other perspectives, more interesting, if I'm allowed to say that, perspectives around doing research, the delivery changes. We've done all sorts of different things across the centre around having arts-generated projects. Hannah has an exhibition on soon, which is generating results from what they've been doing. There's all sorts of those questions where how we can connect research into our communities is actually going, you guys lead the way, we'll give you the money, you disseminate and design our findings and talk to those communities, because it's all well and good we sit here and go, oh, we're going to interview people, but what if people don't want to talk to us? Which we're finding, I personally think we're finding that way more and more as we go on, that people don't want to talk to us because we've been asking the same questions for the same years.
Interesting. So also people are getting fed up with being researched again and again.
Oh yeah, particularly in Lambeth where the centre is, unfortunately, particularly in Lambeth. But so across the board.
Will you have people saying that? Will you have people saying to you, will you've asked us these questions before and what happened?
I think about 3 people have said it today during our conference. Yeah, very much so. I think how research gets disseminated is one thing, but what happens from that dissemination for us as academics is entirely different for members of communities. Like when I think back to research I've done as a care leaver, I look at those projects I took part in, and then I look at how the care system's working and people leave supported living and are homeless at 18. And I think I shared my experience of that 10 years ago, and that's still what's happening. And I'm sure some of the outputs have changed, and I'm sure some systems work differently. But of course people are getting tired of being asked because we've been answering the same things for a really long time.
And I guess that's quite hard. That's hard for researchers because researchers don't have the power to change all those things as well, do they? They can provide the evidence and then have to hope that policymakers and others change things.
Yeah, and I think what is the opportunity to be really interesting about that is to go, yes, there is research, yes, it has a place within this system. It absolutely does. I will never say otherwise. Researchers from non-lived experience perspectives ask interesting questions and have a place within what we do, but beyond that question of impact is the question of going, how is this reaching the communities and how are communities being able to enroll this into what they do? I had a conversation earlier with someone from a NHS trust asking how do they get connected with us, and I didn't really have the answer. Sorry, Craig. I didn't really have the answer because academia is in a lot of ways so far away from all of the people which are able to make those changes. And yes, those changes come from systems, but also they come from talking to mental health nurses and going, have you considered this option about restraint is actually awful? And a lot of them haven't. So it's all of those sort of more intimate things that communities can deliver that academics can inform. So.
And Kwajo, is research always far away from, say, what's happening in activism, or is there research that's not being done that could be really useful for somebody like you who's trying to get change?
Yeah, I mean, it's a very, very interesting question. I don't think it's far removed from what I'm like doing at especially a grassroots level. There's certainly, I think, having that lived experience, things specifically, I think could be better researched or researched in general to sort of help with the work that I'm doing. But that's through lived experience and going out there to speak to people currently going through it. Right now, but research is so important, especially for the work that I'm doing. And often when I think about research, I think of organisations like Shelter, right? And they talk about homelessness and have done for many, many years and had the data and passed that data on to government. So it's not that it hasn't been there, it has. But I think the biggest impact is it then being coupled with lived experience, myself and others going out there and actually showing, well, no, it's not just about the numbers you're seeing in a boardroom or in your office. These are actual individuals, people with lives who are being impacted. I mean, from my own personal perspective, right, if I was to take any of you guys in the audience into one of the homes with me, the first thing you're going to think isn't, well, how much is it going to cost to fix this? The first thing you're going to think is, well, this is absolutely horrific and no one should be living like this. And I think that's the importance of lived experience. Often, politicians and government for a very long time haven't looked at things through the angle of what's morally right, what's just, what's the right thing to do. And it's been looked at as, well, what's the impact going to be on the economy? And when they do their cost benefit analysis, it's more so, well, how much is this going to cost? Is it going to be too expensive? And therefore they don't tackle the issue. And that's with all the data that's out there already. But then when you drag them out and force them to see, well, the impact of ignoring it and what that impact is, it actually forces them to think, well, long term, what is the benefit of this? And actually the benefit far outweighs the cost. But there's a lot of short-termism within politics at the moment that I think needs to change, not just around housing, but around multiple issues. But across the board, research is so important, but it has to be coupled with the impact on ordinary individuals who are out there and having to live through the consequences of policy being in place. And I know you were just having the discussion about research and people researching with lived experience. Say the same about politics. Perhaps if there was more people within politics with lived experience in terms of policy, it would be more informed and successful first time round, rather than us having to go through repeat policy changes because it's failed in several different areas, whereby if they had someone in there actually with that informed lived experience, they may have got it right first time round. So that's the importance of the both, I think.
Thanks for that. And Will, it would be interesting to get your perspective on this. I know you used to work for the civil service, didn't you? And so you must have seen in practice what difference does it make where there is some research, and how do you then get that, use that evidence to get that put into practice so that you've got evidence-based policy? Is that much harder than it sounds?
Yes, I was a civil servant quite a long time ago, back when it was under the last Labour government, so things will have changed. I think it's harder than ever to get evidence in front of politicians, so leaving aside the role of the civil service, but you've got MPs spending more time than ever dealing with constituency caseloads as a result of all the problems we're talking about, so less time to think about policy issues. You've got the 24/7 media and social media, and the lack of policy journalists driving a kind of comms eating policy culture and reality. So it's, politicians have less time than ever, especially backbenchers, to absorb research. And I think it's just really important to think about how can you kind of maximize the bang for the buck of what evidence is going in front of them, and in particular what causal evidence can we provide that's really compelling about how problem X causes problem Y, but also how solution A can solve problems X and Y. And yeah, going back to the whole thing about qualitative versus quantitative, let's do both well, but can we also try and produce more evidence that sort of test the hypotheses around the causal links between things, so that we can say, here are some outcome numbers, and here is some qualitative evidence, but also here is some really kind of persuasive evidence that this is the root cause of the problem, and this is what we can do to solve it.
What sorts of things would you like to see tested?
I'd like to see much more evidence. We're about to produce a report that synthesises evidence about the negative impacts of wealth inequality, which we're calling a wealth gap risk register, which isn't really a risk register, but it's an excuse to lay things out in a nice kind of heat map, because it looks nice and politicians like heat maps. And we've got, here are 41 negative impacts of wealth inequality across society, the economy, democracy, etc., etc. One of them in there, which there's some evidence for, but I'd love to see more, is the way in which wealth inequality is a causal driver of poverty. It feels like there could be much more evidence around that. It's something that people intuitively understand, but the hard evidence isn't there yet, and I think that would be a really important area to do more on.
And do you find that that some people don't believe, even though there is lots of evidence, that inequality matters, say, when it comes to mental health?
Yeah, and I'm hoping that this sort of work, can be effective at changing opinions. I mean, I think, as I said before, the new government, are much more receptive to these sorts of arguments. But, as Kwajo was saying, there's still the kind of cost-benefit approach and mentality. And, it feels like change is happening slowly in terms of the investment, understanding the investment and the return on investment, all those sorts of things. But, you know, going back to when the NHS was founded, it wasn't founded on the basis that it was going to be good for quality adjusted life years. It was founded as a, you know, a moral crusade.
And Omari, in your area of work with young people and mental health, what's the research that you would like to see done? What are the questions you think would be good to have answered?
Well, first it starts with providing more funding for smaller groups like youth organisations and youth clubs to do that kind of research, because I feel like the research that is usually done is from above, and then it's just they just throw money at it and then revisit it next year. And if you provide that funding for the smaller groups like youth organisations, like let's say like BIGKID, who I work for, to do the research, you're now getting on the ground and more effective research that's day to day, because they're actually interacting with young people day to day, so they know it will be much more effective research that will be conducted. And I feel like it's tricky because, like I was saying, it's not just a straight line in terms of in mental health and in terms of young people, but providing that funding, the right work can be put in place for young people to get help and whatnot. And I remember saying this, I had a conversation with the King and Idris Elba, and I was saying that young people are mental health.
You had a conversation with the King and Idris Elba?
I know, everyone
that is such good name dropping.
Everyone always
having
tells
this
me
conversation with the King and Idris Elba.
I like to stay humble, but but yeah, I was having this conversation with them, and and I remember telling them that, you know, like youth work, because they asked me the similar question, like what would I like to see, and youth work and mental health is an ever-moving goalpost, and like I was saying, you can't just throw money at it and think, okay, yes, let's put more work into, I don't know, more training, and that's about it. We'll revisit it next year, see what the numbers are doing. You know, providing funding to smaller groups is essential for you to get day-to-day effective research that really will answer these kind of questions. Okay, why is this happening? Why is a young person acting this way? Okay, this and this is happening, or the home that they're coming from, or this particular area is producing said amount of young people acting this way. Why is that happening? You know, and then especially for young people that are coming in, it gives the development team a lot more room to play with and to experiment on what works, what doesn't work, and provide the help that they can.
And do you think there would be an appetite amongst young people in groups to take part in research? We were, you know, talking about people saying that they were, you know, fed up with constantly being researched on, if you like. But do you think there would be an appetite if it was done by the groups themselves?
Yes, definitely. So even when I talk to young people, and I ask them certain questions for work that I'm doing in terms of impact reports and whatnot, sometimes they offer to help because they want to get involved. They want to also know what's also going on within their age bracket. And I feel like I was saying, that's more effective on the ground research, because a young person knows what they're talking about. They're living that experience, you know, rather than, I don't know, not to say, I don't know if any of you are 52, but it's just a random number, but a random 52-year-old saying that, you know, this and this works best for you, and it's not really that's what works. So definitely, if there is that space for young people to get involved in their own research, I definitely feel like there will be a lot more change, and you'll get a lot more eye-opening things that probably have never been said or seen before. So yeah.
I'm glad I don't happen to be 52. That's good. But Andy, let me ask you, at the Centre for Mental Health, I know you were a driving force behind the Commission for Equality in Mental Health. And how much of an impact do you feel you were able to have? You know, how much of an impact can you have with reports? And does what happens to them, does what you want to happen to those reports happen?
Great question. I'm actually 52, by the way, so I'm mortified.
Somebody had to be.
My bad.
And even in those 52 years, I haven't talked to the King or Idris Elba. If they're available, I'm here. I am ready. I'm not avoiding your question. The Centre's been around for about 40 years, just under, and I've been around there for about half of that time. So you can probably work out when I started, if you're good at maths. And I think we have to kind of acknowledge some things. First of all, that a lot of research and the way research is funded and the way research is communicated has served the status quo very well. It's allowed things to stay as they are. It's put a focus on things that are very much individual, very much clinical. There's nothing wrong with that. We need good clinical research. We need peer-reviewed journals to be there, putting research out into the world with proper checks and balances. But guess what? Nobody in the policy-making world is reading it. And if of course all it's doing is replicating the status quo, maybe that's not a problem. But therefore we are missing opportunities. So one of the things we try and do with our work, first of all, I think that interest in kind of peer and community-led research and evidence gathering is really important. We have to start acknowledging that evidence isn't an objective thing that's always right, and that traditional ways of getting evidence need to be challenged. So that's a really important thing we need to think about. I think we also, one of the things I've observed, and this is kind of one of my, I don't do the research, but I take the research. I have lovely colleagues who do research, and I take it to politicians and policymakers and journalists and people in local councils and all the others. If the research says something they already believe and want to believe, they'll just believe it straight away. Absolutely great. Thank you, Andy. That's wonderful. We'll do that. Or not necessarily the last bit. We'll do that when resources allow. If they don't like what it says, they'll find every reason to disbelieve the methodology and to tear it apart and to find a reason not to like it. So again, this is how these power structures reinforce themselves. What we do, and it's imperfect, but what we try and do at the centre is, first of all, it's about the communication. Communication is half the job. When you've done the piece of research and you've written it out, you're halfway through. It's not finished. You've done that bit, but there's a whole bunch of other bits about how you assertively communicate. You make sure it's written in plain English, respectful to the people that you're working with. Where possible, some of those narratives are co-produced with the people you're working with. This isn't about research subjects and all that kind of old school stuff. And then we need to think, so we think about, well, let's have really good quality reports. We take them to policymakers, we go up and down to Westminster and all the other places, and to integrated care boards as they are now, and God knows how many other ways in which decisions have been made in the NHS over the last 40 years. We've got to be proactive with the evidence we've got. We've got to never take no for an answer. We've got to find smart ways of not taking no for an answer. I'm not going to lie to you, it's really difficult.
And do you get forced in a way to then have to oversimplify it in order to communicate it and then lose some of the nuance that might be really important? I mean, I've sometimes heard people say, well, what you have to do for policy is you have to be able to have 3 bullet points on a slide and nothing more. But which is so different from some detailed report where the nuance might really matter.
Yeah, I think this is. I think that's where there's a real challenge, and that's where really good communication practice is incredibly important. Our colleagues who help us to communicate our work are invaluable. They're often taken for granted. They're often seen as, oh, just a press officer or something. I've seen that endless times in academic organisations and some charities. We have to value that exercise because it is possible to get nuance into these things. Yes, you need your top line message. Yes, you need something which is going to get the Guardian interested, or whatever. But you do need to within that have a responsibility for how you communicate it. And sometimes what that means is that we don't go for the punchy headline because the punchy headline will be misunderstood, and we almost kind of hold ourselves back because we could probably do more clickbaity stuff. But it's deeply irresponsible. So it is a real challenge. We want to get our research noticed, but you have to do that in a way which is respectful of the people that gave you that intelligence in the first place.
And Will, can you relate to this and when you're trying to get your message across?
Yeah, absolutely. Yeah, it's really challenging. You're trying to communicate incredibly complicated, nuanced issues. And as Andy said, if people fundamentally disagree with the message, they will find ways to discredit the messenger as well as an added complication. It's a balance. It's an art, it's not a science. But it can be done well, so there's no reason not to.
And Karen, we've heard quite a lot of challenges there in a way to the way that academic research gets done. And there are, there's reasons that go back a long way, some good and some not so good, in why it is done in the way it's done. How do you do all this? Include everybody else, include different groups, co-produce things, and still keep to the quality of the way that things have been done and the reasons that things have been done in certain ways? Is there a kind of balance to be struck for that research to still be taken seriously and to be really rigorous?
It's such a tough question. I think the center is really kind of leading that in many ways. I mean, I'm a quantitative researcher, so it has been quite interesting working with, a variety of people, different methods. I think involving people, with lived experience from a wide variety of different kind of methodologies, as Cassie mentioned, is critical to this. And I think you can maintain quality. I think it improves the quality. And I think we've seen that through a lot of the work that the center has done in terms of really focusing on issues that are central, in terms of working with the research questions, changing or modifying research questions. And then also we've heard about how important it is to present the research results. And that's something that I think as academics we can really learn from other people, because we often get lost in the nuance instead of thinking of what the key messages are, just really clearly and simply.
And obviously you're doing lots of this research in the centre, but are some academics afraid of this kind of research when they don't need to be?
I think it's always a challenge because, I'm older than 52, but, many of us comes from different traditions of doing research and different ways of doing research. And as Will said, there's a huge emphasis. I work with a lot of health economists, which is wonderful, but on causal, like actually showing the causal effect of things, which is absolutely critical. But with real life research, you're not always able to do that. So it's just trying to gather as much of, different ways of doing things and different evidence as you can. And I think universities are changing. I think the center and the testimony to the Research Council is recognizing this as well in terms of funding the center.
Yeah, thank you. I think that's a good question. I'd be interested to know what you all think about that, actually. Kwajo, I suppose the way you're getting your message across is through campaigning. So how would you change things?
Yes, and I think it's sort of the most immediate form of showing just how bad situations have become. And it's one word, and it's shame, unfortunately, and it's often shame that gets the change that you want. And it takes shaming politicians, it takes shaming those responsible, or those who are responsible for making sure this doesn't happen, and it takes shaming them for something to actually be done. So in my example, in my work that I do, going into someone's home, right, filming there, uploading it on social media, that person could be complaining for 12 years, all of a sudden it goes viral, the local MP, God knows who else, sees and comments on it, there's public outrage, and within 24 hours they're moved out, but they've been complaining for 12 years. Or you'd remember during the pandemic, I know ITV News and other, like BBC, other broadcasters were going into hospitals and showing people who were very unwell having to sleep in corridors because there was no hospital beds, and all of a sudden there's an outcry and a sort of panic and shame at government level for this happening, and understanding that actually this is an issue that's been growing for many, many years and something they can't shy away from addressing, and it takes that. But really we only sort of get that at a grassroots level. You have to be going out there into the community, speaking to ordinary individuals who are going through it, not just housing, getting stuck in, putting your boots on and going into people's homes or going into these places where people are struggling. We all know they're struggling, and actually giving them a platform and showing everyone else, those responsible, what their lack of decision has led to, what is actually happening at a grassroots level. And that's what's been getting changed, coupled with policy, right, and research, because then they can't turn around and say, well, they haven't been warned about it, because you have, but it's just been shown and conveyed in a way that is now shocking you, and it's shocking you because it's shocking so many others out there who are able to empathise with the situations ordinary individuals are going through, which morally and on a moral level they absolutely should not be going through as human beings. And that's what it takes, unfortunately. It shouldn't take that, because these individuals often are elected into the positions that they are to make sure these issues aren't happening. But it's them failing and us holding them to account, which then forces their hand in creating the change that we're demanding. So you are completely right in saying that, and it takes the work of all of us to recognise that, and recognise the important work campaigners and ordinary individuals do going out there and getting stuck in at that level. The sort of I don't want to say trauma, but trauma it has on them as individuals, but also those going through it. And whether you are going through it personally or not, making sure you are sharing that too, making sure you are having those conversations, talking about that, because it's when people talk about it, right, that the conversation continues to grow, and that is how we get change, unfortunately. But I completely recognise that, and I want to see more people like myself and other grassroots individuals, ordinary people going out there and doing it, given a platform to actually share these stories, whether it's housing, whether it's healthcare, whether it's education, whether it's mental health, you name it. There's so many issues out there, and we need to be hearing real life stories, because that's what will get the change that we need, I think.
And when you see those individual life stories where something goes viral, and then they say they get moved and get new housing, do you ever see ripple effects from that, or does it that helps more than the one family who need rehousing? Do you then see improvements across everyone?
Well, now that, I mean, when I first started, and I started going into homes in London, right, because I couldn't afford to leave London constantly and go out side. So I remember the sector turning round to me, and it was it didn't turn round to me because they refused to meet with me, but they turned round on the news when the news approached them and said, well, this is terrible, but they're all isolated incidents. And someone that works for one of the leading sector areas within housing, I was told anyway by another member of staff who I'm friends with now, when I first started posting on social media, it was reported back to them. They said, oh, don't worry, no one uses Twitter anyway, so it's fine. 3 years later, now I'm being asked to speak on their panels. So, I mean, it does change things, but as a sector too, they're making those improvements in recognising, first of all, taking accountability and admitting actually there is a problem there, and there's been a problem there for a very long time, which took a long time to try and convince them of. But two, that change needs to happen, not just at a local level with local authorities, but also at government level too, because we've recognised this isn't just isolated incidents. This is going on up and down the country and has been for absolute decades. So once you get to that point, the only thing then that they can do is create a national plan to really want to change things. And I've seen that with housing. Still not perfect. I mean, things seem to be getting worse, but they're going to get worse before they get better. But even at conference, for example, and in terms of government, the conversation has changed, and it's gone from, oh, what is economically viable in terms of money, I mean that sort of cost that I was talking about earlier, to the financial benefit, but also the moral benefit on ordinary individuals too and their lives, and that recognition, regardless if you're Prime Minister or you're living in a council home that's fallen to bits, no human being should live like that. And again, it's not just housing, we need to be seeing it across other sector areas too. I know I'm a housing campaigner, so I need people coming out and doing that and pushing that agenda.
Yeah, no, fair enough to come from your perspective. And Cassie, how would you answer the audience members' question about how do we get this message across to get things changed?
It's a hard one, for sure. At the risk of flattering the system. In a previous life, I was at NHS England, and I spent 4 years there campaigning for them to insert lived experience directors across a lot of mental health care within themselves and across a lot of ICBs. And to greater and lesser extents, that's kind of happened. To lesser extents, but it has happened. But I think the point is that you're absolutely right. What makes immediate change is this sort of hard-hitting, immediate, shame-based narrative. I completely agree. But systems slowly, in some situations, are beginning to think about there are other ways of knowing, other ways of understanding that we need to be listening to. At the risk of insulting my day job, I think academic knowledge has a specific space. I think lived experience knowledge has an absolutely equal space, but it's not given equity of authority. It's not given this equity of power. And that begins, unfortunately, with positioning people in those director positions, and hopefully that way of knowing becomes more accepted throughout that system as it journeys down. When we look at mental health care right now, where lived experience is particularly listened to is in things like peer support, which is absolutely fine, but a lot of people that work in peer support are capped at sort of band 2, band 3, band 4 within the NHS. They're not able to climb up and get their perspective and their messages and their lived experience of this system heard. So unfortunately, we have to position people at the top to get that knowledge go downwards as well, and where that begins to happen, more policymakers share those spaces. They do begin to listen to these things. I will also equally say, every policymaker I have ever met understands this. They understand it so intensely and go, we don't know what to do either, and I don't know if that is an excuse for them or makes us all feel a little bit more hopeless than maybe we did before, but it's a much bigger question than going, how do we get policymakers to understand? How do we get them to listen? Because a lot of them are positioned going, we've read these things, we can see it. Policymakers which previously worked on the front line are there going, I was on the front line for 10 years, there's a different system now and it's worse, but I was there 10 years ago. And they don't know. So for me, it's as much that question of going, we need to have those conversations with them. They need to see how people are living. They need to have lived experience present and hold that knowledge with parity to others, as much as was all working together and going, this has to be different and it has to be a joint decision.
So Will, what would you say? So it sounds as though, policymakers do often know this evidence and have seen this evidence.
So I completely agree with what's been said already, and I think an additional way of winning the argument, unfortunately, is to persuade more policymakers that inequalities of all forms are a risk to the UK. That inequality. So I used to work on tax campaigning for a fairer, more transparent tax system, and for example, trying to get the UK government to force all its overseas territories to introduce ownership registers. And years of campaigning to no avail, and then Putin did something in 2018, I can't remember what, but it was definitely something bad. And suddenly there was a kind of Russian kleptocracy angle, and boom, there you go. And when I worked in civil service, I worked on the National Risk and Resilience Framework, which is all about flu and bioterrorism and planes falling out of the sky and that kind of stuff. And I think there's an opportunity for government to think about inequality of all forms as a driver of all these sorts of risks. And there's obviously an argument around this summer's riots where inequality plays a role in that. Or if you look back to the 19th century when the Great Reform Act extended the mandate for voting, that was largely a reaction to a perceived risk, which I think was a real one, that the shit was about to hit the fan, that people had pitchforks and weren't afraid to use them. And I think there is a real risk that various forms of inequality, in particular of wealth, pose to social cohesion. And there are lots of examples where those impacts have been severe. So I think there is an argument that can be made, not just to politicians who are progressives, that inequality is a risk that needs to be taken seriously.
So shaming might work, and getting people with lived experience into more senior positions, and emphasising there might be a massive crisis if you don't do a bigger crisis than now, if you don't do something about it. What would you say?
I think it's a combination of everything, because definitely, especially with young people, people at the top need to be getting stuck in, and with housing as well, the living conditions of some people, the young people that have to live in, is really bad, and then they have to go into school, do homework. Sometimes they're the carer, or their parents are working long hours. They have to now take care of their brothers or sisters. When are they going to be able to do homework? When are they going to be able to have friends, go out with friends? Now that child is now isolated, and now when they act out or act in a certain way, they're now labelled. And then, like we've all been saying, none of these inequalities are new. They've been things that have been here for years, decades, and it begs the question, why are we so bad at doing something about it, which is the question today. And I feel like the people at the top are almost scared to get involved, or they're scared to actually get stuck in. Why? I don't know. I'm still trying to figure out that answer, but it's like I say, it's an ever-moving goalpost, and it's sad to see that a lot of young people have to go through a lot of things. And when we see things like Top Boy, or certain some shows like Supercell, and some people may turn around, oh, that's glorified violence, or that's glorified living conditions, but that's a lot of young people's reality, and that's just the digestible way that these directors have put it to the public to really see that these are what the living conditions that young people have to go through. So I definitely think it's a combination of all things, and definitely more people at the top needs to get stuck in.
Yeah, and that's interesting that something like drama can make a difference to show people what is there, in the way that the drama made a big difference to the post office scandal. Yeah. And Andy?
Yeah, I think that importance of a shock to the system, because systems like to reproduce themselves and stay the same, so sometimes you need a shock. The positive thing is, I think when you've then got that sense that something has to change, then suddenly people in positions of power, or those in positions of power, suddenly need a bit of evidence in front of them. And that's when, you know, a responsible carrier of the evidence, using what we know, distilling what we know, and creating good quality information, can actually have a hearing. Mental health inpatient services have been pretty poor in some places for years. Suddenly we have some documentaries on television which shows that, and all of a sudden people in positions of power are a bit more interested in that. And that then creates a platform to have a conversation about, well, how could they be better? What should we be doing to change that system? And guess what? It's complicated. There's a heck of a lot of stuff to do. So that's when the nuance comes in. But at least creates the platform for that conversation to happen, and that is really important. In the meantime, of course, we can't wait. And I think that bottom-up thing, that ground-up thing, is really important. That we don't have to wait for those in positions of power to come to us. It's also about how we try to be the change and do the things that will make a difference in that really kind of very, very micro everyday level.
And Karen, a thought on getting that message across?
Having rallied against numbers, I think numbers in this case really do help. I think the kind of economic consequences of not doing anything, I would go with the dire consequences route. So for example, just in some work that we've done looking at the impact of austerity, so the cuts, we were looking at cuts to social care and the impacts that had, and that seems to have led to some inequalities in care, and that the poorest older disabled people are protected, but those people who are just slightly better off are not. And these just kind of disparities are likely to have effects on mental health, and other work has shown that people who do receive care report better mental health. So if you can show that you might be saving money in some way, but then the knock-on effects, if those people end up in hospital, you know, not being cared for at home, is going to cost a lot more. I think that kind of evidence is very persuasive. So.
And is part of the difficulty that sometimes those economic savings won't be seen for a really long time. So if you do something about child poverty now, you're going to see results when it comes to mental health in adults in 20 years, in 15 years, and that feels like miles away.
Yeah, I think it's that, and I think it's also kind of the silos I was talking about, because if you can save, you know, on your pensions bill, but all of a sudden it ends up on the healthcare side, they're not so worried about that. So I think that's the kind of, you know, reasoning for really having more joined up thinking in all of this.